Good afternoon and welcome to the National Collaborative on Childhood Obesity Research's Connect and Explore webinar. My name is Rudy Karnick and I'm excited to host today's webinar. Today's spotlight is Click, Click, Cook, online grocery shopping leaves food deserts behind. First, Dr. Eric Brandt will provide an overview of a recently published study in JAMA, which is called Availability of Grocery Delivery to Food Deserts in States Participating in the Online Purchase Pilot. Then, Mr. Jerry Mand will discuss opportunities to expand programs and policies to increase food access and improve diet quality in food deserts through online grocery delivery services. After that, we'll have some one-on-one Q&A time with the authors of the study to respond to your questions. And finally, we'll close with some encore announcements. We'll be live tweeting during this webinar, so if you're on Twitter or other social media platforms, we encourage you to join the conversation by using the hashtag ConnectExplore and following @NCORE on Twitter and @NCORE on Facebook. We're so grateful to have some of the authors of the Availability of Grocery Delivery to Food Deserts in States Participating in the Online Purchase Pilot study on our webinar today to answer your questions. We'll have Dr. Eric Brandt from Yale University School of Medicine and Mr. Jerry Mand from Tufts University. To start things off, we would like to open up with a brief poll. You can submit your answer directly on the screen. Our question for you today is, which of the following professional categories do you most identify with? Student, practitioner, professor or educator, government, academia, student, nonprofit, food industry, or other. Please take a minute to pick one of those. All right, thanks for taking a second to answer that. It looks like we have about 43% of you from the government, 21% from academia, about 7% of you are students, almost 25% in the nonprofit industry, almost 3% in the food industry, and then the rest of you other. Thanks so much for doing that. And now for today's spotlight. First up, we'll have Dr. Brandt present.
Thank you very much. So I'm going to start off by telling you about and walk you through the study that we had done, which is a geographical study that looks at the availability of grocery delivery for SNAP recipients in a pilot program that was performed under the Farm Bill. So in 2014, the Farm Bill mandated that a pilot be performed to allow SNAP recipients to use their benefits at select online grocery stores in 8 states. The online purchase pilot is really the main focus of our study. So online shopping has many potential benefits, including the convenience to shop when you want, the opportunity to compare pricing before purchasing, scheduling delivery pickup at the store, and even having the groceries delivered right to your home. One of the groups that could benefit the most are those living in food deserts. Food deserts are places where a high proportion of the population has low income, low access to grocery stores, and low access to personal vehicles. Because of the difficulties in access, delivery of foods directly from grocery stores is one option to improve access to healthy foods. Food deserts are an important environmental contributor to poor health outcomes, including these negative food environments being associated with unfavorable cardiovascular risk profiles, obesity, diabetes, hypertension, and other negative health consequences. So thinking about this purchase pilot, the fundamental question really is, if there's going to be a pilot of online shopping and food deserts are historically associated with health problems, is this pilot set up in a way to be the most helpful? Are online shopping and delivery even available for those that live in food deserts? And this brings us to the aim of our study. What we had sought was to determine how many food deserts in the 8 online purchase pilot states and the households within them are located within the current grocery delivery areas. Our analysis was a cross-sectional analysis, and we had to use multiple data sources to try to answer this question. So I'm going to break it down the methods into 3 steps to make it understandable. First, we had to identify food deserts. Second, we had to identify the delivery areas. And third, we had to quantify the food desert delivery availability. So first, identifying food deserts. So what we used was the USDA's Economic Research Service Food Desert Research Atlas, and here is where they define food deserts as area of low income, limited access to grocery stores, and low vehicle availability. To provide an example, let's take a look at the areas around Washington, D.C. and Baltimore. What we see is all these areas are census tracts that are identified as food deserts that meet that criteria. Then what we did was we used the Housing and Urban Development's crosswalk files to translate these census tracts into zip codes. And we had to do that because zip codes is how delivery networks are truly tracked. We limited our study to the 8 states that were included in the online purchase pilot, which were Washington, Oregon, Nebraska, Iowa, Alabama, New York, New Jersey, and Maryland. Second, we had to identify the delivery areas. We did this by using Nielsen's TV Links dataset, which provided us all of the groceries in all of these 8 states that accept SNAP. We then used Google to identify retailer websites and reviewed each website manually to see if they delivered and to which zip codes that they actually delivered to. Now, because zip codes and census tracts are not mutually exclusive or multiple zip codes could fit within a census tract, we had to convert the delivery areas back and forth, and this resulted in 3 potential groups being identified. So first, if all of the zip codes in a census tract had delivery available, then we coded these as being fully deliverable. If only some of the zip codes in a census tract had delivery available, we coded these as partially deliverable. And if none of the zip codes in a census tract had delivery available, then we coded these as not deliverable. Now, once we classified all the census tracts, our primary outcome was the percent of the census tracts and the SNAP households within them categorized as fully, partially, or not deliverable. Our secondary outcomes were comparing the same thing, but by urban and rural status, as well as by state, since there might be significant variation. And what we had done for our comparisons is we used the Fisher exact test or Monte Carlo simulation of the exact test to get our result. Now, let's look at some sample characteristics. So in these 8 states that were participating in the purchase pilot, there were about 13,000 total census tracts, of which about 10%, 1,250, were food deserts, the vast majority, 95% of which, were in urban areas. If we look at how many SNAP households were within these 8 states, what we found is there's 2.8 million households that received SNAP, about 18% of which were in food deserts, and again, the vast majority of which are in urban areas. Now here's what we found. Among the 1,250 census tracts that were in our study, the vast majority, about 89%, were fully deliverable for grocery stores, 2% were partially deliverable, and 8.9% were not deliverable. If instead we look at the number of households that were counted, what we see that similarly, 90% of the households were fully available for grocery delivery, 2% were partially available, and 7.5% were not at all deliverable. Now, this finding on the last slide is very important because of how it translates. What this means is that in these 8 states alone, that 450,000 households, which is about 900,000 individuals, 400,000 of which are children, and 120,000 of which are elderly, could increase their access to groceries and grocery stores. Now, if we look at it a little bit different way, based on urban and rural status, the majority of the census tracts in the study were urban. And what we see is that in the urban areas on the left, we see that the vast majority, again, 93% of the census tracts were fully deliverable, about 1% were partially deliverable, and 5.9% were not deliverable, which is in stark contrast to the rural areas, of which there were only 59 census tracts. There were no areas that were fully deliverable, 30% that were partially deliverable, and about 70% that were not at all deliverable. So let's take a look at this, what this looks like geographically. I'll bring us back to the image that I had shown earlier of the areas around Washington, D.C. and Baltimore. Again, in black are all the areas that are census tracts identified as food desert. And all of these lie within the state of Maryland, which had a pretty high rate of delivery available at 92%. And what we see is that all these areas that were labeled as food deserts in the map actually qualify as being fully deliverable, meaning that they could have access to online grocery store and delivery. This is different than some of the other areas that were included in the study. So let's consider this area, which is central Alabama, which is an area of mixed urban and rural census tracts. Although Alabama overall still had a high level of availability of delivery at 72%, what we can see here with the areas in yellow being not deliverable and the areas in brown being partially deliverable, that these large census tract areas, which are the rural census tracts, do not have delivery available, whereas the blue census tracts, which are closer to urban centers such as Birmingham and Montgomery, do have delivery available. The other way that we had broken it down was to look individually at the results by states. The y-axis on this graph represents the percent of census tracts. The x-axis represents the states. And what we see is that the proportions in each state that were deliverable differed significantly across them, from 100% in New Jersey down to 72% in Alabama. Now note also that there were varying levels of rural counties that were in each of these states, which I pulled up here. We can see that some states had more or less rural counties, but even not shown here, but in a separate analysis that we performed, regardless of urban or rural status, there is still significant variation across the state. So in conclusion, what we can say about grocery delivery is that it's available for most food deserts, that 8 out of 9 food desert census tracts fall within current delivery networks, and 9 out of 10 households that receive SNAP in these food deserts do also fall within grocery delivery networks. We also found that delivery differed by urban and rural status as well as by state. One potential pitfall of delivery in this scenario is that it could serve to exacerbate current rural and urban health disparities, such as hypertension and obesity, which are more prevalent in rural areas and greatly influenced by dietary components. There's also some limitations for our study. This includes that we only studied the 8 states that were participating in the online purchase pilot, thus results might differ in other regions, which, as we had seen in the state analysis, could certainly be true. And also that delivery services that were not directly connected to brick and mortar stores, which is how we got our data for the stores accepting SNAP, could have been missed. Therefore, our results could have potentially been underestimated. Our study also has significant implications. The 2018 Farm Bill that passed last year now mandates that this online purchasing pilot go nationwide after the pilot's completion, which can happen as early as April 2021. However, the current bill does not finance grocery delivery, which means that the impact of this on populations is likely to be limited since some will not be able to gain access to the new resources. It also gives potential options for future research, including understanding better how best to leverage grocery delivery to improve both access and quality, understanding which groups will be most likely to use and benefit from online delivery, as well as how we can utilize incentives and disincentives with online purchasing platforms to improve SNAP diet quality. As mentioned before, these results in a very similar fashion are presented in a recently published article on JAMA Network Open, which is freely available online, so I encourage you to check that out. And before I go on to the next section of my talk, I'd like to thank my co-authors, David Silvestri, who's at New York Health and Hospitals, Jerry Mand, who's on this call, and then Maggie Holland and Joe Ross, 2 of my mentors at Yale. All right, so now I'd like to put the study into a little bit of context and more of the current state of affairs. So one of the questions that's been really more closely discussed in regards to food deserts is that, are they really the result of poor nutrition? Are there other underlying factors? And one of the studies that I'd like to highlight here is a recent article from the Quarterly Journal of Economics from 2019 that begs this question of whether or not food deserts are to blame for dietary inequalities. And what they had really looked into studying is what happens when a grocery store is introduced into a food desert. It'd be natural to surmise that individuals gaining access to healthier foods would improve their food purchase quality. It's a natural consideration. However, what they found is that when a grocery store is introduced into these new geographies, measures of healthy eating, which is seen in the bottom graph here, actually does not improve. And furthermore, if we look specifically at areas where that are food deserts where there were grocery stores introduced, we can see that on the top panel, even though more expenditures occur at these stores, what happens is healthy eating index actually does not improve. So that introduction of these new access without a focus on quality does not necessarily translate to better eating. Now, these authors went a little bit further, and they tried to underpin what underlies healthier food purchases. And here, what they had said is that what they had found was that really what associates the most with better diet quality was household income. On the upper left, they found that higher household income associated with lower added sugar, higher household income associated with more whole grain purchases, as well as more produce purchases. And overall, the more income somebody has is associated with better quality of overall diet. This brings us back to the implications from the projects previously presented and the one that Jerry and I completed. The implications I'll re-highlight here are that we need to know how best to leverage to improve not only access, but also quality. There are also potential opportunities with online platforms to integrate incentivization systems or disincentivization systems that could drastically improve dietary quality, mostly surrounding removing the barrier of price of food. Now, the last thing I'll talk about is the Food Insecurity Nutrition Incentive Program, which is now known as the Gus Schumacher Nutrition Incentive Program, or GUSNIP, commonly colloquially known as the Double Up Food Bucks Program in some states. This program sought to use economic incentives in multiple ways to increase purchase of fruits and vegetables, using several strategies that could be chosen individually based on the state, where SNAP recipients receive some sort of incentive that could be redeemed for qualifying fruits and vegetables. In this program, what they found is that this incentivization program led to increased expenditures on fruit and vegetables among the recipients. Now, I think this is also a reflection on the prior study, which suggests that increasing the affordability of foods may be where the greatest impact will lie. And all the studies that I've presented in totality, I think, reflect the fact that although access is important, cost may be what matters the most. Thus, for programs such as online purchase pilot to find success in improving dietary quality, it must be coupled with incentives or disincentives. All right, so thank you for your time, and now I'll pass it over to Jerry Mand.
Well, thank you, Eric, and thank you, NCORE, for having me here today. And it's a delight and pleasure to be here as a former steering committee member of NCORE, also to see colleagues among the participants, and again to thank Eric for the outstanding job, as you heard, he did on this important study. And so let me start. This year, actually last year was marked the 50th anniversary of the only White House conference on food, nutrition, and health. And diet quality is an important factor to consider in SNAP as we move forward. So 50 years ago at the first White House Conference on Food, Nutrition, and Health, the nation faced a nutrition crisis largely around hunger. That, as you know, at that time people found the type of hunger that was expected only in third world countries in the United States, with calorie protein malnutrition being the typical clinical consequence. Today, 50 years later, the nation faces another nutrition crisis. Poverty, food inequality, and food insecurity are still big problems in the nation today, but the clinical consequences of those have changed dramatically over those 50 years. As a result of the findings 50 years ago in that White House conference, a range of programs, including SNAP in its current form, were put in place. And as a result, today we have 15 feeding programs and $100 billion with a B of USDA spending to address the problem that was seen 50 years ago. And as a result, today people have access to calories, but often the quality of those calories are not great. And as a result of today's nutrition consequences and today's nutrition crisis, which is poor quality diets that result in more and more people being sick, especially low-income people, higher health care costs, and even impacts on national security. So this slide here is a study that I did with colleagues in Tufts, that was in JAMA. And this next series of slides will look at what we know about diet quality in SNAP recipients versus other parts of the population. And in these slides, you'll see a common comparison that's made between people who are higher income, people who are low income and on the SNAP program, and then also people who are income eligible but are not on the SNAP program. So this slide looks at those groups, and as you can see here, In the three columns, the column to the left are SNAP participants. The one in the middle are income-eligible participants, but not in the program. And then SNAP participants, the income-eligible, on the far right are the higher income. And now if you look at the rows, you can see these are looking at diet quality measured on a scale used by the American Heart Association. And so you see on the ideal diet, right, with the SNAP recipients, it's the lowest. With income-eligible non-participants, it's higher, and still higher more for higher-income people. Now, this data comes from, I should point out, from the NHANES data, and it looks at a period of time from 2000 to 2014. And I think the key message here is that over that time, as diet quality has improved overall in the population, it has not improved among SNAP recipients. And so that's seen in the next two rows as you look at the intermediate and then poor diet, where poor diet is steadily declining among income eligibles and higher income people, but has remained steady in people on SNAP. Now the next slide comes from USDA's food apps, and Joanne's work and others that's enormously helpful. And again, let me just draw attention to the bottom one here, but again, this is looking at those three populations of SNAP recipients, income eligibles, and higher incomes, and we'll look, you can see it across categories, but looking at the bottom, looking at the Healthy Eating Index, the government score for how diet quality, you'll see once again, this is significant that from, and I think two key messages here. One, that all American diets need to be improved greatly. But looking among these groups, as you go down from higher income to income eligible to SNAP recipients, diet quality gets worse. Another really interesting study in this area is one done by Justine Hastings at Brown University, where she had data from 6 months prior to going on SNAP, and then 6 months after people went on SNAP in large grocery retailers in her area of in New England. And so the first thing was, I think, a really important finding captured in this slide, which is that SNAP works. That the extra dollars that people get, if you look at traditional economic theory, is it simply offsetting people's spending? That it's just completely fungible. That money would be spent, on whatever, it frees up funding and people use it here. This actually shows that SNAP works, and that you can see that at a higher percentage than would otherwise be expected, people do use the money to buy food. And so by providing this additional income, if you go back again, thinking 50 years ago at the time, there was a push to just provide income. That's what most other countries do. But the United States is unique in that it addresses this problem through food assistance, and particularly, now nutrition, as SNAP stands for, assistance. And so this shows that by providing food assistance, that in fact you get a higher percent going toward food than you might see under economic theory had you just provided money. And as a result, you have, as we've seen over 50 years, you don't have the calorie protein malnutrition. It's that the focus on spending on food has resulted in fact, the food purchases. Which has given rise to a number of people and advocates in the field to saying that if you look at today's problem, you look at diet quality, if we could simply raise the level of SNAP, maybe going from the thrifty food plan to a low-cost food plan, that would be sufficient to improve diet quality. However, in Justine's other study, looking at this, she found that that's not the case. That, as you can see here highlighted at the bottom, that closing the gap in food spending between higher and lower households would not close the gap measures of food healthfulness. I think that's consistent with the work Eric showed us as well. So, when I was at USDA, we did a study looking at foods typically purchased in SNAP homes. And one thing I'll point out about this is it's interesting in the previous studies as well. This is not this type of data is not easy to come by. That the program, in fact, in law, we don't collect routinely each year where the purchases are made. That was recently made more difficult in the Supreme Court, that further restricted the government's ability to ask retailers what's purchased. But here, in this one study, USDA did go to a large national chain and sought to find what households typically purchase with their SNAP benefits. And many of you have seen this before, but I wanted to highlight it again, which shows that the number one purchase in the SNAP program, when you look across food categories, as is typically done in this type of study, that soft drinks make up the number one purchase in SNAP recipients. And you look to the right, I think a key point is it's not that, with the regular population, it's SNAP, it's number two, whereas milk is number one. So they're close. Again, this notion that the entire population eats poorly and needs to improve. But I think a key point is that, here with SNAP, the government's paying for the food and then, of course, paying later on Medicaid for the health care costs. So much like with the Medicare program, even though health care costs are a big problem for the nation overall, the government does make a special effort to look at health care costs in Medicare and try to bring those under control, much as SNAP should do here with food. So here's another, I think, important study and insight into this, and this was done by the National Academies of Medicine, looking again at the supplemental food, looking at SNAP, and looking at sort of the different factors and what plays a key role in terms of the diet quality and nutrition that people are able to get in amount of food. And the area circled is a little difficult to read the side, but the area to the left here that's circled highlights how important time is. And I think that's a critical insight that needs to be considered, and that probably time is the greatest barrier that low-income families face in making their food choices and food purchases. Therefore, policies that address that issue are essential to improving both access to food and improving diet quality, and also, again, why a program like the online purchasing is so important and so potentially helpful here. So next I want to show you another study we did at Tufts that looks at different policy options for improving SNAP diet quality. So this is a study we did. It's a microsimulation that looks at various, actually look at three specific interventions that could improve diet quality over different periods of time. And you can see, again, this is based on Haynes data using this microsimulation model. And so we looked at three interventions, the first being a fruit and vegetable incentive, much like FINI or GUSNIP that Eric mentioned, which is a 30% incentive for fruits and vegetables. The second case we looked at is the 30% incentive for fruit and vegetable with a restriction on sugar-sweetened beverage purchases. And finally, an intervention we're calling, a number of authors have called SNAP Plus, which is a 30% incentive, but then a 30% disincentive across all food categories. So not just sugar-sweetened beverages, but looking at other high-risk foods recommended that we eat less in the dietary guidelines, including things like processed meats and other high sugar, low nutrition quality food. So looking at the result, this looks at cost effectiveness. And so what you see here on the left, you see cases of cardiovascular disease that's averted. Also on the right, quality adjusted life years gained. And what's important, again, looking here, we're looking at 5, 10, 20, and over a lifetime. And we're looking, and you see that just fruit and vegetable incentives alone, which is the strategy that's been followed so far by government in trying to address diet quality lapse, lags far behind when you simply measure an incentive with a restriction. So just even putting in a sugar-sweetened beverage restriction, you can see how sharply different the disease result would be. Same on the right, that incentives alone take, first of all, almost no impact in a shorter time frame, and even by a lifetime have minimal impact. Now this chart kind of puts this in I think, clearer terms, and particularly for an audience with a large number of people from government. So this looks at it first from a societal perspective and shows that over time, what the net savings would be by these different things. And again, you can see that their savings for all three, that incentives alone over a lifetime would provide $6.7 billion in savings, but again, substantially less than simply adding just a sugar-sweetened beverage restriction, and certainly much less than if you add a broader set of disincentives. And I think the most important graph is this last one on the right, where we're looking at it from a government affordability perspective. So looking at it both in terms of cost effectiveness and traditional cost effective measures, and actually even cost savings. And so what you look here from 5 to 10 to 20 to lifetime, what we're seeing in the first set is that a fruit and vegetable incentive alone over a 5-year time frame, so the period between farm bills, for example, is extremely costly and not meeting any traditional criteria for cost effective. You can see even if you go out 10 years, which is a usual sort of snapshot for congressional budgeting, and that the Congressional Budget Office uses engaging programs, you'll see now that the incentive with restrictions, which was within 5 years, was just slightly outside the cost effectiveness range. Now you see at 10 years, while the incentives alone are still more than double by any sort of standard of cost effectiveness, you have, just by adding the restriction, actually get down well within the range of cost effectiveness. And then even by 20 years out, you'll see that that incentive alone as a policy does not become yet cost effective, though gets close. And then you can see even at a lifetime, though, finally, an incentive program will become cost effective. And you can see on the others as well. The other thing I would highlight is while an incentive with just a restriction becomes cost effective just after 5 years, well within that by certainly 10 years, and even by any measure dramatically cost effective going out beyond that, it is important to note that, and what you're seeing in the green line is that the SNAP Plus, the incentive plus broad disincentives, actually becomes cost savings even within 5 years. So for those in government expenditures and budgeting, in the case with the incentive and restriction, for other things we do in healthcare, typical screenings, all of those things, you can see that the incentive and restriction meet those standards. But as a cost savings measure, as some are often seeking savings in the SNAP program, actually an incentive with a broad set of disincentives can actually become cost saving within 5 years and increase there beyond. But that a set of policies that rely solely on incentives will not become cost effective until over a lifetime. And that's the conclusions shown here. The last thing I'll mention is in terms of policy options, 2 projects that I've been involved in. One is the Bipartisan Policy Center in 2018 put out this report of its SNAP Task Force, Time to the Farm Bill, which looked at ways to improve diet quality in SNAP, and found that the #1 recommendation was making diet quality a core SNAP objective. So today, SNAP, it's the nutrition's there, it's the supplemental nutrition program, but food insecurity and actually fiscal integrity overwhelm the priorities in the program. And the finding here was that diet quality should become a core objective as well. There are other things you can look at the report, improving SNAP Ed. There are several other things that can be done as well. Also pilots that allow further study, like the one I showed you a minute ago. And finally, not out yet, but I began my talk by talking about the 50th anniversary, and that we had a conference last October in Boston and DC, celebrating that, honoring that, but then also looking at priorities to come forward. The report for that conference, much like there was a report 50 years ago, will be issued on March 24th at the Bipartisan Policy Center. That release will be open to the public, but I'll give you this a preview in the areas that we look at, and over almost a dozen areas and 60 recommendations. There are policy recommendations around SNAP that, once again, focus on making diet quality as a core objective and strengthening SNAP Ed infrastructure, retail standards, and other priorities. And with that, I'll end my talk.
All right, thanks so much to both of you. And now it's time for Q&A. As a reminder, if you would like to ask a question to the authors, please use the chat box on the right of your screen, and we'll address it during this one-on-one segment of today's program. Looks like we're already getting some questions. Our first question is, are there any upcoming studies or developments on this topic that we can look forward to? I'll let either Eric or Jerry, I'll let one of you answer that.
So I don't know of any that's anybody that's specifically looking at delivery, although I've certainly had several conversations, and there are some larger organizations that are starting to consider ways to make delivery more viable and maybe even more impactful, including consideration of delivery of more total nutrition diets that package together like foods that are appropriate for their cultural norms, and or other ways to package food for total meals, which may be one mechanism to improve the ability to maximize the utility of the benefit and also improve health. And there's some others, including Seth Berkowitz, who's done some studies of more of this medically tailored mealed objective, that's more, which is more directed towards individuals that have known specific diagnoses of disease.
Thanks so much. Another question, is there any data on the demographics of SNAP recipients and who is using their benefits for certain categories of groceries? For example, educational level, ethnicity, age, etc. Jerry, you might be able to answer this one.
Sure. I mean, yes, USDA has a lot of data on the demographics of recipients, but not so much on what they purchase. So, and I think there, of course, the food app study is a tremendous advance, and I'm sure you've spent other sessions looking at that, and would encourage you to continue to do that. Also, I think individual studies, working within some grocery stores, particularly a chain in the Southwest, HEB, which does a great job not only with quantitative and qualitative data, really looking at SNAP recipients and their purchasing habits. But so the overall data about participants in the program, I think, is fairly good. Data on how they're using their benefits is slowly getting better. I think food apps will make a big difference in that.
Great. This question might be for both of you. If SNAP pays for food with the hopes of improving health, why pay for soda and low nutritional value? Why not say those foods aren't covered? And also, would covering the cost of delivery improve health?
Well, I'll take the first part and then let Eric, maybe on the second. I think that that is the question. I think it's been debated for a long time. If you go back to the original statutes creating a SNAP, there were debates and there were amendments to restrict the food access even then, when diet, the crisis was largely one of calorie proteins. But people, I think, already, if you go back again 50 years, that first White House conference, the overwhelming discussion was around hunger and diet and health meant largely the calorie and protein malnutrition that resulted. But then also it was emerging that heart disease, cancer had a diet cause as well. So there was a beginning focus on that, and as a result, even then there was a debate and votes on whether that would take place. You fast forward to today, where it's so clear that diet quality needs to improve, that the consequences of, if you're in 20 states, the Medicaid program and the SNAP program are in the same agency, and the heads of those agencies are in deep conflict and trouble over the cost of their Medicaid program that they can see are being driven up by diet quality, yet have very little that they can do with SNAP to improve diet quality. But this is something that will need to be, that I think USDA can do a lot more than it's doing, especially with the SNAP education program. But it's something that ultimately Congress would need to address to make that change. And hopefully that will happen over time.
And then I can address the second question some too, about covering the cost of delivery, whether or not that could improve health. And to go back to our study, while I was doing it, the observed costs for delivery varied between no cost, once you've reached a certain threshold, up to about $10 per delivery order. And that varied by region, even amongst the same stores. I think even that small amount of money could be a barrier, if not no cost, to individuals. And any cost at all might be a particular barrier, because even if you're allowed to use your SNAP purchasing online, that doesn't mean you have either a debit card or a credit card where you'd have the ability to pay for the additional delivery fee no matter how small it is. So I think for a certain proportion of the of SNAP recipients, then it could be a substantial benefit to remove that final barrier from being able to utilize the program.
Thanks so much. Can one of you talk more about how to incentivize purchasing foods with higher nutritional value through SNAP?
Sure. Again, I think that's being tried, and so we had, first there was a healthy incentive pilot 2 farm bills ago here in Massachusetts, which showed some improvement, and that gave rise to a FINI, which then gave rise to GusNIP. And so in each of those iterations, the program has greatly expanded from one site and a few $million in the initial pilot to $20 million a year over 5 years for FINI, and now $50 million over 5 years for GusNIP. And I think the question is, what models will work? I think one thing that we've observed is that as we went from the original pilot to FINI, the focus was largely on farmers markets. And over that time, I think USDA particularly, focused on farmers markets from 2010 through 2017. We went from maybe a couple hundred farmers markets having the equipment necessary to use these kinds of incentive programs and use SNAP benefits to more than 8,000. And so I think the USDA did an outstanding job making this available to SNAP recipients at every farmers market. But unfortunately, it did not result in greater usage of farmers markets. I think the need in order to better understand SNAP populations and where they purchase, and I think that's being addressed through the GusNIP, in that farmers markets are still a priority, but that the focus is much more on retailers. And that will be interesting, because probably the political support for GusNIP, where you see so much support there, where they have extensive expenditures on administration, technical assistance, training, pilots on a produce prescription, where a program like SNAP-Ed that's 8-9 times the size doesn't have any of that support in the Congress. The support that I think GusNIP has largely is because it did help local agriculture and farmers markets. So as the move moves more toward retail, it'll be interesting to see if the congressional support is able to maintain as well. But the last point, again, as I showed in my slides, that while incentives can help some, I think the greatest barrier they face, and at GusNIP at $50 million a year, I would say that's an at-scale program for small agriculture in terms of the impact it has on farmers markets, retailers, others. But in terms of at scale for the SNAP recipients, it's too small to have an impact. And when I think with the slides I showed you in our microsimulation study showed that it will be difficult to make the case to scale it up, because it's just extremely expensive by any measure until that Congress uses in terms of judging the cost versus the benefit. So I think that to really make diet quality through incentives work, I think it has to be paired with some sort of incentive or restriction to bring the cost down.
Great. Eric, how big is the limitation of not capturing data on online-only retailers, for example, Amazon?
I think it's small, and I did look actually also to see with Amazon, there's various service lines that they have, one of which is Amazon Fresh, which does provide local potential for local produce, and they do have some retail stores, I believe, in New York City and in Seattle. And their area of service is so small directly from that service that it really, I don't think, added significantly to it. And even on Amazon Pantry and Amazon itself, although they do provide some foods that could be qualified as produce or healthy nutrition foods, their markup and the barrier from cost to join as a service, I think doesn't make it as attractive of a retailer, and I don't think I could consider it as a true grocery store, just Amazon or Amazon Pantry alone. So overall, I think pretty small in comparison to the typical brick and mortar stores that people shop at and would also then use for their local delivery.
Thanks. Jerry, where will the White House conference report be available?
Sure. So it's going to be released on March 24th at an event at the Bipartisan Policy Center in D.C. It'll be available. And I can send you, so you can send out. If you haven't seen already, there's a website from our conference on the 50th anniversary. It will be available there. I'd also encourage people to go there. We put together a video using oral histories on the 1969 conference. The videos from the 3 days of conference we did will be there, and the report will be there. It should also be available ultimately at the National Ag Library, who is a partner with us in putting together the conference.
Thanks. This is for either of you. What recommendations do you have for local health departments to improve the diet quality among SNAP participants?
So I'll start. I think a big thing is for to take advantage of the SNAP-Ed and FNEP programs that they have in their state to put together a program to do that. So I think that FNEP on the education side, but SNAP-Ed, while it's maintained that name, was expanded to be a education, but also policy systems and environmental change, and really focused on improving diet quality among low-income people. So if you're at a health department and you're looking for the resources to do that, SNAP-Ed provides that to you, and every state's in the program. It's run through the state social service agency, but I would encourage you to find out. USDA FNS has a great website on SNAP-Ed Connect, where you can see for your state how much money you're receiving in SNAP-Ed, what are who are the lead implementing agencies, and also a state agency people on that, and you can connect with them. CDC, their Office of Nutrition, Physical Activity, and Obesity can be very helpful here as well. Laura, who I think might be a participant on this call, in fact, spent time with us in SNAP-Ed to do that. So I think they're a great resource in connecting state local health departments to SNAP-Ed, which I think does provide the resources that I think most states don't take advantage of, but could, and local health departments could, in terms of providing resources to help with that.
And the other thing I'll add, and Jerry, you can correct me, that in the Farm Bill, there are several potential opportunities, particularly for state governments, to try different pilots that focus on some of the areas that they've identified as needs, including access for individuals that are at high risk of inability to access foods. So I think there's some opportunity to be creative at the state level from how it's written in the Farm Bill.
Thanks for that. Looks like we have time for one more question, and if you didn't get your question answered on today's webinar, don't worry. We will ask our experts and get it emailed out after the webinar is over. So for our last question, given that there are no marketing restrictions for online grocery stores, how do you think about trade-offs between potential access to more healthful foods from online shopping versus potential exposure to more pervasive marketing?
Yeah, I think that seems like an obvious risk, and hopefully the early work is to try to move towards the utilization of the platform towards healthful foods, and that's where, when Jerry had spoken about incentives and disincentives, utilization of online platforms also allows for building in those sort of incentives and disincentives, which can hopefully overcome that marketing. And even in grocery stores, the way that they're set up and shelf space is purchased is built towards that sort of pervasive marketing. And I'm sure there'll be similar attempts with online grocery shopping based on things such as suggestions for additions to your cart. But with the barrier of incentives and disincentivizations to promote better quality, I think that could potentially be overcome.
Yeah, I'll add to that. I think it's a very important question, and of course, as we all know, if you in the physical grocery store, product placement is a big deal where things are. There's a lot of investment in money and time and work by food companies to sort of nudge your behavior in grocery stores. As you can imagine quickly, that's taken a whole magnitude higher online. Whereas you're in a store and there's a physical space and you can do things to nudge people, online that can be taken to just a much higher level in directing kinds of people's behavior. I think one of the solutions, lies in USDA. I think participation in the SNAP program is a privilege that, stores, right at 60, I think, billion still in food costs that are provided to grocery stores, others. And really USDA should take advantage of that leverage, which it hasn't yet. It was one of the recommendations in the BTC report that I mentioned, is that they should start with pilots and ultimately use that leverage in terms of the privilege of participating in the program to set rules in brick and mortar stores about product placement. If people want to participate in the SNAP program, again, a free choice, they don't have to participate in SNAP, but if they do, there should be rules governing product placements and efforts broadly in the store, and that should even be more of the case in terms of something like an online purchasing system for SNAP, and making sure that stores are using nudges to get people toward healthier options, not less healthier options. And the very last thing I'll say is just for future discussion is that as much sense as online purchasing makes for SNAP, it makes even more, and hopefully we'll see in the WIC program, because for the government, it would be, as folks know, for WIC, unlike SNAP, the customer is not price sensitive. And so to expand the WIC program in times of tightening budgets, having people purchase less expensive options would make sense, and stores like Walmart and others provide that, but they're impossible for WIC recipients to use. It's almost a scavenger's hunt to go there and try to find purchases. So one can quickly imagine how as effective as we've seen that online purchasing can be in SNAP, it could be much more so with WIC.
Great. Thanks so much to both of you. Now, before we let everyone go, we just wanted to share a few NCORE announcements. So for upcoming events, just remember, if you're interested in what NCORE is doing, events we're going to, latest research tools, etc., sign up for our newsletter. We have an upcoming Connect and Explore webinar called NCORE's Tools in Action, featuring the Summer Physical Activity and Friendship Study, which will be on Thursday, March 5th at 2 p.m. We'll also have a booth at SOFI in Atlanta, Georgia from March 17th to the 20th. And NCORE will be presenting there at a student workshop on Wednesday, March 18th. Also wanted to share one of our latest resources. We have a new white paper out on our website called Advancing Measurement of Individual Behaviors Related to Childhood Obesity, Implications and Recommendations for the Field. You can find that all online. If you have any other questions about today's webinar or anything else for NCORE or upcoming activities, please email the NCORE Coordinating Center at ncore@fhi360.org. To access the webinar recording, you can go to our website and click Webinars at the top navigation. All of the upcoming and archived webinars are displayed there. Once again, thank you so much to the authors for joining this really special webinar today, and thanks to all of you who attended. We hope you have a great rest of your day.
This concludes today's conference call. Thank you all